Many people believe that sleep is the safest moment of the day, the body at rest, the mind switching off, the heart working at a steady rhythm. But for those over 60, this rest can hide silent risks that are rarely mentioned in medical appointments. What is surprising is that we are not talking about smoking, high cholesterol, or lack of exercise. The villain can be something as ordinary as the way you lie down at night. While you fall asleep without feeling pain or discomfort, your brain may be facing an invisible battle against gravity, impaired circulation, and reduced oxygen. And when the problem shows itself, it is often too late. Slurred speech, an arm that will not lift, sudden mental confusion. These are classic signs of a stroke. Aging affects more than just skin and joints. The blood vessels that carry blood to and from the brain lose elasticity, become narrower, and less efficient. At the same time, the blood tends to thicken more easily. Now, imagine this condition combined with a sleeping position that makes circulation even harder. It is as if, every night, a rusty water pipe were tightened even further. Sooner or later, the internal pressure causes a failure. Some habits may seem harmless, but they multiply the risk of stroke in older people. Sleeping on your back may seem the most natural and comfortable position, but when the head is completely level with the heart, the blood has greater difficulty flowing freely back from the brain to the rest of the body. It is as if the blood vessels were under more pressure, since they do not have gravity to help with this drainage. During the night, a natural phenomenon occurs. Blood pressure tends to rise slightly. For those whose vessels are already stiffer and narrower due to age, this combination creates a dangerous scenario, as blood can accumulate in certain regions and encourage the formation of clots. If these small clots move, they can block brain arteries and trigger a stroke. That is why the recommendation to slightly raise the head between 20 and 30 degrees is not just a matter of comfort, but a practical way to protect the brain. This incline reduces the pressure inside the vessels, aids drainage, and ensures that blood flow circulates more efficiently throughout the night. Sleeping on your stomach may feel cozy, but for the body, especially in people over 60, it is one of the most harmful positions. In this posture, the neck has to stay twisted to one side for hours, compressing important arteries responsible for carrying oxygen-rich blood to the brain. This constant compression reduces the amount of oxygen available to brain cells, and this shortage can cause silent imbalances that raise the risk of stroke. In addition, lying on your stomach limits the natural expansion of the lungs. The weight of the body on the chest and abdomen reduces the ability to breathe deeply, which lowers the intake of oxygen into the blood and causes a buildup of carbon dioxide. In younger people, the body can compensate for this drop in oxygenation with quick adjustments, but in older adults, the body no longer reacts in the same way. This means the reduction can go unnoticed and, over the hours of sleep, become dangerous. This combination, reduced blood flow to the brain and limited oxygenation, creates the ideal environment for the blood to become thicker and clots to form. The risk, therefore, is not only in the discomfort of the neck or the difficulty in breathing, but in an entire silent process that weakens cerebral circulation night after night. Covering the head with the blanket may seem like a way to seek comfort and security, but in practice, it is a risky habit, especially for those over 60. When the head is fully wrapped in fabric, the entry of fresh oxygen is reduced, and the air inhaled is practically the same that has been exhaled. This means that the person breathes in less oxygen and inhales more carbon dioxide than they should. During the night, this buildup of carbon dioxide acts silently, altering the natural balance of breathing and circulation. The brain, which needs constant oxygen to function properly, begins to work with an insufficient supply. This lack causes micro-awakenings, fluctuations in blood pressure, and encourages the thickening of the blood, increasing the risk of clots. The problem is even more serious in older adults because the body is no longer as efficient at compensating for the drop in oxygenation. While a younger person may only experience discomfort or a headache upon waking, someone older may spend hours with the brain operating in a low-energy mode without realizing they are at risk. This condition, repeated night after night, significantly raises the chances of stroke and other cardiovascular complications. The feeling of warmth and protection when covering the head hides an invisible enemy: breathing recycled air. What may seem like a simple habit can turn into a dangerous factor for brain and circulatory health. Even the seemingly harmless position of lying on the right side with the arm under the pillow can be harmful. In addition to compressing nerves, this posture puts pressure on vessels such as the carotid artery, reducing blood flow. Blood, which is thicker with age, can clot more easily without the person linking the habit to the risk. The good news is that small changes make a big difference. It is better to sleep slightly inclined, around 20 to 30 degrees, to help drain blood from the brain. Use pillows that support the neck well, but without forcing the chin forward. Avoid positions that compress arteries or make breathing difficult. If you need to sleep elevated, choose an adjustable bed or a firm wedge rather than relying on a recliner. Keeping the bedroom well ventilated is one of the simplest and most effective ways to protect health during sleep. An environment with good air circulation prevents the buildup of carbon dioxide, ensures more oxygen for the brain, and reduces the feeling of suffocation during the night. Light blankets also make a difference. By allowing the body to breathe better, they prevent overheating and contribute to deeper, more restorative sleep. It may seem like just a detail, but after the age of 60, details define the quality of life. Adjusting the height of your pillow to keep your head slightly elevated, choosing a resting position that does not compress your breathing or circulation, and even opting for soft and cool bedding are simple measures that act as real shields against serious health problems. Practicing these habits night after night not only improves immediate rest, but can also mean years of extra independence, preserved memory, and vitality. Sleeping is essential for living well, but sleeping safely is crucial to continue living healthily. If this content has helped you better understand how small changes can save lives, thank you for reading this far. Subscribe to the channel, like this video, and share it so that more people can learn how to care for their sleep and health after 60.